My name is Traci Baird. I'm the president and CEO of Engender Health. I'm based in Washington, D.C. We have offices and programs throughout Asia and Africa. I think that the world is making a lot of progress in gender empowerment, and we can see that as evidenced by changes at the parliamentary and government level in a number of countries. I was recently in Ethiopia, where they are working towards gender parity in their government, and the parliament recently elected the first female president, who was gracious enough to sit and talk with me about the priority of gender equality. We know that Canada, Justin Trudeau, prioritized a gender-balanced cabinet, and when he was asked why, he said, because it's 2015, and the room broke into applause. We also know that Rwanda prioritized females in government, and now has more than 60% of their lower house as female. But we also know that despite electing record numbers of women to the House of Representatives in the United States, we still have less than a quarter of the members of the House in the US who are female. And until all girls and women can see themselves represented at the highest levels of their national government, I think it's hard for everybody to feel that they can participate fully in civil society. So while I think we're making great progress and great strides, it's an indicator as well of the distance we have yet to go. We are celebrating our 75th anniversary this year. We're a nonprofit international organization that has a history of working on family planning programs. We've expanded that over the last several years to focus more on a broader sexual and reproductive health and maternal health remit. We have programs in Africa and Asia, and while we focus in many of those programs on reproductive health, we ensure that we're doing so while also connecting our work to work that addresses gender-based violence, that links to HIV/AIDS programs and services, that addresses cervical cancer, that works on safe abortion and post-abortion care, and in some maternal health work that we do, we address the problem of female genital fistula. So we do all of these things in a number of places, working closely with governments and with local partners to ensure that women and girls have the ability to access sexual and reproductive health services and ensure that they can grow up healthy. So at Engender Health, we take high quality services and the development of quality very seriously. In fact, it's a hallmark of our work globally, and it's something that we are known for, and we're proud of that. We start by first assessing what the gaps are in quality as measured against international global standards, but also the requirements of the Ministry of Health and the priorities of a specific area and facility. We make sure that there are trainers and healthcare provider training that meets all of the standards and ensures that people really learn the skills that we're trying to convey. So we'll do on-the-job training and coaching to ensure that the skills are really absorbed and taken on in the location where those healthcare providers will be providing family planning or reproductive health services. We then ensure that there's follow-up and coaching and supervision in a very facilitative way so that we're monitoring constantly the quality of services being provided. And as we do this, we're building the capacity of the Ministry of Health and Health Service at every level, the state, the district, and immediate facility level, so that they can continue to assess and address quality even beyond the lifespan of a project. Quality to us also has a lot to do with counseling and the thoroughness and engagement of counseling. So we emphasize an approach to counseling that is very responsive to women's needs, helps educate her about her choices, supports her in her decision making, and then supports her in the implementation of her choice of a family planning method. So it's not just giving her information and hoping she has the confidence and content and knowledge to make a choice, but really supporting that whole process. And here in India in particular, that often involves supporting the process of her decision with her family and her husband in particular. So we really respect a woman's own voluntary and informed choice, but the quality of the counseling is what is going to help us get there. We also pay attention to the quality of the infection prevention in a facility, the supplies, the systems, the monitoring, the data. Because if you don't have high quality data, it's very hard to make decisions based on that data. So quality for us is a theme that goes throughout and links very closely with our theme of capacity building so that there are sustainable services in the public sector well beyond the lifespan of any particular project. Yeah, so we've been in India for a number of years and we're currently working in 5 states. We have an adolescent health project in the state of Bihar. we are working on family planning in one project that's in Gujarat and Rajasthan, and in another project that's in Maharashtra and Karnataka. And in those projects, we're introducing some modern methods of family planning that have recently been approved by the government or have been identified as methods that need more support to ensure that women have real access to them. So we work very closely with the central government and follow their stewardship and partner with state governments as we implement projects to improve the quality of family planning and related services. And we do this, of course, because we really want to make sure that women have the opportunity to be fully healthy, to live into their full potentials, and to promote gender equality and women's empowerment across India. The project there is remarkable. We are in 14 districts in Karnataka, working in the districts that are considered the highest priority because they are the lowest performing on certain health indicators. Because although Karnataka's health system is quite well developed, there are disparities, and it's important to us, and it's important to the state government that we not leave women behind. So in those 14 districts, we're working in 60 health facilities, training healthcare providers in the full range of everything they need to provide the highest quality family planning service. We emphasize counseling and helping women know all of their choices to make a free and voluntary and informed decision. We ensure high quality service provision itself and very good infection prevention, record keeping, and management of services. Part of the project also works with the community health workers, the ASHAs, the assistant nurses, and the AWWs. These are thousands of women who are the real strong link between the healthcare facilities and women and their families. And so with those partners, we are ensuring that women know about the services that are available to them and that they have the confidence to go and seek those services. While we were in Karnataka and Bangalore yesterday, we had the pleasure and honor of meeting with the Honorable Chief Minister and also the Honorable Minister of Health, who re-emphasized their support for health care and especially for the family planning program in the state. And it's an honor to make sure that we are partnering with them. Our other main partner in the project, of course, is the Bill and Melinda Gates Foundation that's supporting the project both in Karnataka and Maharashtra and allowing us to partner with the government to make the kind of difference that we are. So we're very interested in learning from all of the work that we do. And part of what we are learning is how we can make sure that at every opportunity, at every intersection, we are finding ways to address some of the disparities in gender equity in the communities where we're working and in the healthcare facilities themselves. So we will continue to unpack the linkages between sexual and reproductive health and rights and gender equality in the programs where we're working. We're also really interested in expanding a lot of the work that we do with adolescents and young people and others who have less access and less inclusion already in the healthcare system in India. So we're looking at opportunities to work more with those communities and those populations. And finally, we're always looking at opportunities to expand the geography of our work. We know there's still some areas of high met need, and there are other fantastic development partners working with the Ministry of Health to address some of those needs, but some are not being met. And it's important to us that we lift up all women and girls in the countries and all the men and boys that are with them so that we can have everyone fully participate in society and live to their full potentials.